But one of the things that I found really interesting is that in a study that was done, 68% of doctors said that clarity, credibility is really important when working with MSLs. We know at the ACMA, the organization that I run, that 80% of key opinion, actually 87% of key opinion leaders, 87%, they told us that if people have, for example, something that enhances their credibility, like the board certified medical affairs specialist designation or BCMAS, they see them as more competent, more credible, more trustworthy. This was a study that was done in about 1,200 doctors. And so we know credibility matters when it comes to meeting with physicians, when we know that being able to articulate information in a credible, clear way is important. How do you think today's MSL? Now, you, by the way, guys, if the head is based all the way in the Middle East and Egypt, so I'm definitely curious to hear about your perspective there in terms of the medical affairs MSL space in Egypt. But how do you think MSLs can get better in improving the scientific content delivery of information, especially now in 2025, where many doctors today, especially doctors who are younger, they want the information delivered differently. It's maybe not like how doctors wanted information delivered 20 years ago, 15 years ago with social media, the internet technology. What's your take on that, Ibtihad?
I think like being an MSL for quite some time in Egypt, as well as like now working closely with MSLs across the globe, I would say like building this kind of trusted partnership and relationship with KOLs would be based on the, as you mentioned, credibility. And we shouldn't be like driving promotional kind of discussions. It should be balanced narratives. This is what drive credibility. Also, like clarity on what we need to address in our conversation and engagement plan with these HCPs. um, we usually have complex data that is shared, and we usually assume that it's easy to grasp for the medical field, but it might not be the case. So making sure that we are simplifying our messaging, making sure that we are tailoring our content based on the needs, interests, and level of knowledge of our HCPs, and more importantly is disclosing the limitations. Usually whatever the data we're bringing, lots of them have like limitations.